faint line on a pregnancy test. What are the causes of a faint line on a pregnancy test? You have done the pregnancy test and the line is showing a very faint line. Causes of a faint line on a pregnancy test. Welcome to our channel today. On this channel, we do talk about fertility and reproductive health. We create awareness about fertility and reproductive health. We answer all your questions in regards to fertility and how you can get pregnant faster. What are the causes of a faint line on a pregnancy test? Gerard Massa, the health educator, is the name of the channel, and I welcome you for today's lesson. First things first, if you have done the pregnancy test and the line is very faint, what are the causes? We shall go straight away and look at the causes of a faint line, and specifically, you could have used morning urine, which is actually very dilute. It is always advisable that you use the very early morning urine before you pee. You should use that to do the pregnancy test. The main reason is that in the morning before you pee, the levels of the HCG hormone, which the pregnancy test looks for, are very, very high. So if you have done the pregnancy test and the levels of HCG are very low, probably maybe because you did the pregnancy test very early in the morning. You did it later on before you actually, after you took lots of water, then there are high chances that you are going to end up with a faint line. So the causes of a faint line, the first cause is that using urine which is very dilute. It's advisable that you do the pregnancy test very early in the morning. Next cause of a faint line on a pregnancy test is you could be actually on medications. If you are on medications, for example, if you are on anti-anxiety drugs, if you are on drugs for asthma, there are high chances that you could end up with a faint line because these drugs interfere with your HCG hormone, which the pregnancy test looks for. Next cause of a faint line on a pregnancy test is using containers which are already containing water. If you are using a sample, you use the urine, you put it in a container or in a tray, or you put your urine sample in a place where there's already water, then there are high chances that you could end up with a faint line on a pregnancy test. And then the next cause of a faint line on a pregnancy test, why you are seeing a faint line on a pregnancy test, is that you could have done the test very early. If you test for pregnancy very early, then there are high chances that you are going to see a faint line on a pregnancy test. Without further ado, we shall also talk about the different types of pregnancy tests on the market. We have those which are rapid, or we have the rapid pregnancy tests, we have the clear blue pregnancy tests, and then we have the cheaper test strips which are available at your nearby pharmacy or drugstore. Now, what happens is that when you go and buy these testing strips, it is advisable that you should check for the expiry date, check that the package is not torn. If at all the package is already torn, maybe due to poor storage, please remember to take it back so that they can change for you. They give you something which is legit, something which is genuine, because at the end of the day, if you take home a pregnancy test which is already damaged or which is already expired, then you are at a high risk of ending up with results which are either false positive or false negative. So causes of a faint line on a pregnancy test is that the urine sample may be very dilute. You might have tested very early, and then it could also be due to the fact that you bought something which was already expired. So it is very important to check for the expiry date. Gerard Massa, the health educator, is the name of the channel, and we are talking about a faint line on a pregnancy test. What are the causes of a faint line on a pregnancy test? Remember, you can ask me all your questions down below in the comments. I will answer all your questions. You can also book to have a private chat with me about your fertility related question on my website, www.gerardmassa.thehealtheducator.com, where we shall talk more about what is happening, and we shall be able to interact and get answers to your fertility questions. You can also become a member on our channel. Show support for our channel by clicking the join button, which is just below this video. It is next to the subscribe button, so you can click on it so that we can support our channel, so that we can make more bigger, more longer videos for you. So we are continuing with our topic for today, and it is, what are the causes of a faint line on a pregnancy test? Faint line on a pregnancy test. So we have also talked about the different types of a faint line on a pregnancy test, and we've talked about the different types of a pregnancy, we've talked about the different pregnancy tests, and we have said that we have those which are called the rapid type, we have the clear blue, and then we also do have the cheaper testing strips. We are proceeding and we are saying that if you get a faint line on a pregnancy test, what should you do? It is very, very advisable that when you get a faint line on a pregnancy test, you have to consult your doctor immediately, who will request a sample of your blood to be taken, and they will do what we call a blood HCG pregnancy test. Your doctor will do what we call a blood or a serological HCG pregnancy test, where a small sample of your blood will be taken, and then still they will look for the HCG hormone, but this time not in your urine but in your blood. The levels of HCG in your blood specifically rise very fast if at all you have conceived, if you've got pregnant. So it is much more accurate, and if at all time allows and resources do allow, depending on which country you are in, then also another test known as the pelvic ultrasound scan will be requested. And during the pelvic ultrasound scan, if these are the ovaries, and then this is your endometrium, the inside of your womb, after fertilization has taken place, after an egg has been released during ovulation, and then fertilization has taken place in this part known as the ampulla, the part which is like a junction of your fallopian tube. After fertilization has taken place and the egg has moved the whole way through by being pushed by what we call cilia. These are hair-like structures in your fallopian tubes. Remember, if your fallopian tubes do not have those hair-like processes known as cilia due to repeated urine tract infections or adhesions or free fluid in the fallopian tubes, then the fertilized egg can remain in the fallopian tube, ending up into what we call an ectopic pregnancy. But assuming that the egg has moved the whole way up to your womb, up to the inside of your womb, known as the endometrium, and attachment has taken place, these features of attachment or features or signs of very early pregnancy will be visible on an ultrasound scan. So your doctor will most likely do an ultrasound scan, and very early pregnancy tests or very early pregnancies on ultrasound normally show thickening of your inner womb. There will be great thickening, and then even there will be what we call a formation of a decidual there will be formation of what we call a double decidual sac sign, or there will be formation of a yolk sac. And then of course, if at all the pregnancy goes up to 6 weeks or even 7 weeks, then there are other features like cardiac activity or the baby's heartbeat will be seen. Gerard Massa, the Health Educator, is the name of the channel. I welcome you to our channel. If it's your first time on our channel, remember to subscribe, remember to join our channel, and remember you can have a private chat with me on my website, gerardmassa.thehealtheducator.com, whereby we can discuss more. We can actually have a more detailed private talk with you. If you are a couple and you have tried to get pregnant, yes, you can book to have a private chat with me, and yes, we shall be able to answer all your questions. I will be able to answer all your questions related to fertility. Thank you for attending today's lesson, and I hope you have learned something about a faint line on a pregnancy test. What are the causes? What are the solutions? The solutions, we've said you do the HCG test still using blood in your nearby hospital, and then you also do the ultrasound scan. Remember, you can get pregnant faster naturally. You just need to get the right information, you need to put your trust in God, and yes, things can work out. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. See you in my next video. Bye-bye. How to get pregnant faster with one fallopian tube. How you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel, we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend. Stay in by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember, you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember, you can easily get pregnant, very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side, and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, and then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes. It is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube, and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality, and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost your ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well, and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also, remember, what is a baffling cyst? In this video today, we are going to talk about the baffling cyst. Hello, my friend. I welcome you to our channel, Gerard Massa, the health educator. On this channel, we talk about the ovulation calendar. We do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. By the end of this video, you are going to know what a baffling cyst is, and what is a baffling cyst, and how best it can be treated. So without further ado, we shall define a baffling cyst, and we shall say that a baffling cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a baffling cyst. So we are going to look at the symptoms of a baffling cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk. and then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina, known as the labia majora, and specifically one side may be very, very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very, very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cysts? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cowpeas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bartholin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bartholin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bartholin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bartholin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bartholin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bufferlin's glands, and the Bufferlin's glands are around the size of pea, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bufferlin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bufferlin's cysts. So it is very, very important that when you have a Bufferlin's cyst, you should be able to get treatment, and the best way of preventing Bufferlin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerard Massa, the health educator, is the name of the channel, and in this video today we have talked about the Bufferlin's cysts, and we have said that these are swellings which become of the Bufferlin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. My cycle is 21 days. How do I calculate when I'm ovulating? My cycle is 21 days. How do I calculate when I'm ovulating? Gerard Massa, the health educator, is the name of the channel, and today we are going to answer the question: if your cycle is 21 days, how do you calculate when you are ovulating? Without further ado, we are going to answer our question for today. And please, if you are a woman looking at getting pregnant, if you have tried to calculate your ovulation day and your cycle is 21 days, and you would like to know how you should or how you will calculate your ovulation day, how to get your ovulation day when your cycle is 21 days, then this video is for you. So without further ado, we shall understand that the menstrual cycle has two phases. It has the first phase known as the follicular phase. Follicular comes from the word follicles. Follicles are those small swellings on your ovaries which actually store the eggs, which grow and then they mature into mature eggs, which actually become fertilized to form an embryo. So the luteal phase is that phase just immediately after you've ovulated. So we've talked about the two phases of the menstrual cycle, and we have said there's the follicular phase and then the luteal phase, and then also on the 14th day. So there are two phases, as we've said. There's the luteal phase, then there's the follicular phase. So what happens is that during the 2 phases, a woman will go into her menses, and these are very, very significant. So we have said that when you see your periods on day 1, you see your periods on day 2, and then you see your periods on day 3, and then you go on and finish your periods on the 4th day. Normally, these first 4 days when you are in your menses, assuming that your periods last for only 4 days, these 4 days are those days of your period. So if you would like to know your ovulation day, if your cycle is basically a 21-day cycle, meaning that when you see your periods on day 1, you are going to see your periods again on day 21. So if you would like to know the day you are ovulating, simply you begin counting from the first day you saw your periods, and then you are going to count 14 days from the first day you saw your periods, and we shall count and say this is day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, day 9, 10, 11, 12, 13, and 14. So your ovulation day, when your cycle is a 21-day cycle, is on this particular date, is on the 14th day. If you would like to know when you are most likely to be ovulating, if your cycle is a 21-day cycle, then it means that you are going to be ovulating on the 14th day. And we have said that you begin counting from the first day, the second day, the third day, and then the 4th day when you finish your periods, and then from there you go on and count until you reach your 14th day. That is basically when you are going to be ovulating. But still, we shall take a word of advice that this does not specifically mean that you are supposed to see your periods on day 1. You could actually begin your periods on day 8. Maybe you could begin on this particular date, the 8th day, and then of the calendar. So you specifically have to begin counting from the first day you see your periods. If you first saw your periods around here, and then you begin counting and you say day 1, day 2, day 3, day 4, day 5, day 6, 7, 8, 9, 10, 11, 12, 13, and 14. So if you were to have your periods on this particular date, then it means your 14th day is going to be around here, and then that is when you are most likely to get pregnant. When do you see, or if you are told your cycle is a 21-day cycle and you would like to calculate the day you are going to be ovulating, you simply begin counting from the first day you saw your periods. Count the 4 days or the 3 days or the 2 days you see your periods, and then beginning from the first day you saw your periods, count the 14th day. That is when you are actually going to be ovulating, and that is when you are most fertile. Remember, the days which are in your periods, if you are in your periods starting from day 1 up to maybe day 4, or even going on up to day 7. If you are a woman out there and you spend a whole week in your periods, then just know that the first 6 to 7 days, those days you are actually infertile. The chances of getting pregnant are very, very low. And then the next days after you have seen your periods, that is beginning from day 8 onwards up to the 19th day, that is up to actually the 11th day, sorry, that is when you are semi-fertile. The chances of getting pregnant are 40 to 60%, and then you are at 90 to 99% on the following days or in the next days leading to ovulation. Remember, the whole process of ovulation is controlled by hormones, and though there could be other factors, but the 99% of the women who have hormones which are balancing very well, the hormones we are talking about are 2. We have the follicle stimulating hormone, the hormone which stimulates the follicles. Remember, at the beginning of this lesson we talked about the follicular phase and then the luteal phase. So follicular comes from the follicles. The hormone which is responsible for stimulating your follicles or your eggs so that they grow very well, and then they end up producing estrogen, which is important in preparing your uterine lining or your womb so that it can receive the fertilized egg, and then implantation takes place. Those 2 hormones, specifically the follicle stimulating hormone and the luteinizing hormone, are released by the anterior pituitary gland in the brain. And when this hormone
when these hormones are released, what they do specifically, they travel to the ovaries and then they stimulate the whole process of ovulation. And that's why if you are a woman and you would like to know when you are ovulating, and basically when you would like to know the time of ovulation so that you can have what we call timed sex, normally you can go on and then purchase the ovulation predictor kits. These are readily available. You can purchase them online. You can purchase them at your nearby pharmacy. These ovulation predictor kits, specifically, they look for the hormone, luteinizing hormone. They look for the luteinizing hormone, although there are some other types on the market which actually look for estrogen too. So what will happen is that you just have to get that predictor kit, and then it looks like the HCG. It looks like the urine pregnancy test strip. You just get it, open it, make sure that you read the manufacturer's guidelines, and then open it. You dip it in the morning urine. Please, you should use the morning urine because the levels of the luteinizing hormone, according to research, according to studies, the levels of LH and estrogen, they are normally high in the morning, beginning from 3 up to around 7 a.m. in the morning. So you get that morning urine and then you dip in that ovulation predictor kit. If at all you were to get the ovulation predictor kits and you used them during these first days, that is from day 1 up to day 7, when you're in your periods, and then even immediately after finishing your periods, these light days, you are going to get actually a negative test using the ovulation predictor kits. The main reason is that there is no luteinizing hormone around here. The luteinizing hormone is going to begin getting high around the time of ovulation, and specifically it is the hormone which is known to actually stimulate the whole process of ovulation. When luteinizing hormone rises around these days here, around your ovulation days, then the luteinizing hormone is going to lead to your egg bursting, and then when it bursts, it releases the mature egg, which goes up to the fallopian tubes at specifically the part which is known as the ampulla, and then fertilization takes place. Remember to ask me all your questions regarding ovulation, ovulation calendar, the ovulation calculator, and then also pregnancy tips. Any questions you could be having, please, my friend, connect with me in my comments. I will answer all your questions. You could also schedule a consultation. You could consult me on my WhatsApp number. You can schedule and then you consult me. I can give you all the time. When you schedule and then you do the booking, I can give you all the time and then we can talk more. If you have any questions and you'd like to talk to me in private, my WhatsApp numbers are on this video. Please, there are two. The first one is +256 701 797876, and the next one is +256 787 668 962. You can book so that when you do the booking, I can actually analyze and then give you more time because there are many clients I'm working on. Remember, my consultation is only for $10 so you can schedule and then I can answer all your questions in regards to the ovulation calendar, the ovulation calculator, and anything related to women health. Gerard Massa are my names, and we have been talking about if your cycle is for 21 days, how do you calculate the time of ovulation? If your cycle is 21 days, how do you calculate when you are most likely to be ovulating? And we have said in summary that when you see your periods from day 1 up to day 7, or if at all you stop around day 4, then it means count from the first day, and then on the 14th day, that is when you are going to be ovulating. And then remember, you do not need to mind about the next days because ovulation happens for only 12 to 24 hours. Alright, Massa are my names, and remember to come back tomorrow for the next video, and have yourself a fantastic and healthy day. May God bless, and please keep watching. I have some important message for you. Thank you. Hello, welcome to our channel. I'm Gerard Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. The ovulation calendar, calculating ovulation, get pregnant faster. The ovulation calendar, calculating ovulation, get pregnant faster. Welcome, my friend, to today's lesson. Gerard Massa, the health educator, is the name of the channel, and in this video we are going to talk about the ovulation calendar, calculating ovulation, get pregnant faster. By the end of this video, you will be able to know all the different topics regarding ovulation calendar, the commonest questions I normally get on this channel regarding the ovulation calendar. We are going to answer them today. After this short break, we are going to answer the ovulation calendar. We are going to discuss various aspects. So thanks a lot, my friend, for watching today's lesson. Gerard Massa, the health educator, is the name of the channel. And before we proceed, we need to first of all define what we mean by ovulation. Ovulation is basically the release of an egg on the 14th day when you have a 28-day menstrual cycle. So if you have a 28-day menstrual cycle, then on your ovulation date, specifically, we realize that it is going to be on the 14th day. But also, we need to first of all understand the safe days and then the danger days. The safe days are those days which begin from the day you saw your periods. So if you started seeing your periods, let's give an example of this calendar. If you started seeing your periods on day 1, this is when your periods have started. Those actually 6 to 7 days when you started seeing your periods throughout the whole week, those are regarded to be your safe days. The chances of getting pregnant in the first week when you have just seen your periods is very, very low. And so there are some women who are very fertile and who have lots of follicles on their ovaries. They can actually go ahead and even get pregnant even though they've just finished their periods. And even women who are taking ovulation medications, for example, if you are a woman and you are taking Clomid, you are taking Letrozole, there are high chances that you can get pregnant in the first week. But immediately after the first week, you realize that the following 2 weeks, basically that is from 8th, 9th, 10th, 11th, 12th, 13th, up to the 14th day, that is basically what we call the danger days or the unsafe days. You are most likely to get pregnant when you have just finished your safe days. So we always encourage couples that if you are looking at getting pregnant, then the 7 days after the following 2 weeks, that is basically the days, or that is basically the period when you are most likely to get pregnant faster. Next, when you want to know the safe days after your ovulation or after your danger days, then the following next 2 weeks, we call that the luteal phase. Basically, your chances of getting pregnant are very low. Now, when you want to calculate the ovulation days, normally you will end up, you will actually use what we call the ovulation predictor kits, abbreviated as the OPK kits. Basically, these ovulation predictor kits, they look like the urine HCG testing kits. What you need to do is you have to look at your cycle, and if your cycle is basically for 21 days, then you start testing on day 5. If your cycle is for 25 days, you start testing on day 8. And then if your cycle is for 28 days, you start testing on day 11. And then also, if your cycle goes for 35 days, then you should test on day 18. The testing is basically done whereby you will be looking for the hormone known as the luteinizing hormone. So we shall also look at the cycle length and then the ovulation period. If your cycle is for 22 days, then you are most likely to be ovulating on day 6 up to day 10. from the 6th day up to the 10th day, that's when you are most likely to be ovulating. And if you have a 24-day cycle, then your ovulation period is between 8th up to 12th. And then if you have a 28-day cycle, then it is from 12th up to 16th. So basically here we are looking at the cycle length and then the expected date of ovulation. So before we conclude today's lesson, we have been talking about the ovulation calendar, and then we are specifically covering some brief tips about the cycle length and then how you can do the testing using the ovulation predictor kits. When you look at the reproductive system of a woman, basically this is how it appears, and you realize that when you look at the reproductive system of a woman, it basically has an ovary which is lined with follicles or egg cells which grow from day 0 and then until you reach the 14th day when they get to be released. Basically this is ovulation happening. What remains is what we call the corpus luteum. So thanks a lot, my friend, for staying around, and I hope you have understood how to calculate your safe days and how to calculate your danger days and how to use the ovulation predictor kits. So I'm really so happy that you have watched today's lesson, and let me know if you have any questions. You can schedule your consultation. The details are in the description. If you want to talk to me, you can go through the description. The details are there. You'll connect with me. You can book your consultation and I'll give you all the time and I'll answer all your questions. Gerard Massa, the Health Educator, is the name of the channel, and have yourself a fantastic and healthy day. Bye bye. And remember to subscribe for new videos we release every day. When you subscribe, you'll be able to watch our videos every day when we release them. We release new videos at exactly 17 hours every day. Have yourself a fantastic day, and bye-bye.
Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.
I have been trying to get pregnant for 2 months, but I always get my period every month, and I don't know what problem I have. Indeed, today's video we are going to answer a question by one of our subscribers who asked and said that she has been trying to get pregnant for 2 months, but she always gets her periods and she does not know what could be happening. She does not know what could be causing this to happen. Gerard Massa, the health educator, is the name of the channel. This is the fertility show where we do talk about fertility. After this short break, we are going to talk about all this.
Hello my friend, welcome for today's lesson. This is Gerard Massa, the health educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerard Massa, the health educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you.
So we are proceeding with today's lesson. We are talking about one of our subscribers has asked a question, and the question is, she has been trying to get pregnant, but she keeps seeing her periods every month. She has been trying to get pregnant, but she keeps seeing her periods every month. The first step we shall talk about is, whenever you are trying to get pregnant, there are 3 things which need to be put into consideration. You should understand your menstrual cycle. You should also understand that the menstrual cycle has 2 phases. We have the follicular phase, and then also we do have the luteal phase. The follicular phase, follicular comes from the word known as follicles, or where the eggs do grow and then they mature. And then luteal is specifically that phase when you have just finished ovulation. So if you are trying to get pregnant, but every month you keep seeing your periods, there could be something bringing about this. There could be disease of the reproductive system. You could actually be having diseases like fibroids. You could be having conditions like endometriosis. You could also be having cysts or even endometritis. When we are talking about all these conditions, we shall begin by defining them. Endometritis comes from the word endometrium, and this is the inner layer of your womb. It's the inner lining of your womb. When you get an infection, or when you get infected with you get a urine tract infection, or you get a sexually transmitted infection, what is going to happen is that this infection can go upwards, and then it can settle into your womb, and then causing fluid to accumulate into your womb. So what happens is that these infections or conditions like fibroids tend to cause what we call irregular periods. And how this happens, it begins with actually bringing about something called hormonal imbalances. Hormonal imbalances normally do happen, and when your hormones are not balancing, then you may try to get pregnant, but you may get difficulties getting pregnant. So to answer the question by one of our subscribers, she has been trying to get pregnant, but she keeps seeing her periods. There could be issues with her hormones. The hormones may not be balancing, and when we talk about the hormones, we are talking about the luteinizing hormone, or the hormone that stimulates ovulation. And remember, we have said in our previous videos that ovulation is the release of a mature egg, and this happens on the 14th day. The next cause of why you are seeing your periods and you are not getting pregnant, it could be due to actually diseases of the reproductive system. We have said that these diseases include fibroids and also endometritis and also other conditions. And then also why you may be seeing your periods without getting pregnant, you may be having what we call an ovulatory disorder, or you could be having disorders in the way ovulation happens. You may be actually having conditions like polycystic ovarian syndrome or polycystic ovarian disease. So specifically, you need to do an ultrasound scan to confirm what is happening. Book your appointment with me so that we can talk more about all this. If you are trying to get pregnant, then book your appointment. Simply go to my website, Gerard Massa, the Health Educator, and we shall talk more. Have yourself a fantastic and healthy day. May God bless us all. Bye-bye. Hello.